A very good afternoon to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, the topic of today's session is Heroes Fight for Health. Join the Prostate Cancer Awareness. And this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all the cancer cases in Indian men, with an estimation of 105,000 new cases reported this year. Additionally, it is a leading cause of cancer related deaths, with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhanced early detection, prevention strategies, and treatments to address the growing impact of prostate cancer in our country. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first, I would like you all to please join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. So, I would like to welcome Dr. Palanki Satya Dattatreya, Director and Chief of Medical Oncology, RENOVA SOUMYA Cancer Center. Good afternoon, Doctor. Welcome to the discussion.
Good afternoon to one and all. Thank you so much, ma'am, for the kind introduction.
So let's begin with the discussion. So first, I would like to know your views about how can you define and what constitute a holistic prostate cancer care and how this is differ from other conventional treatment methods.
So first of all, I would like to thank Dr. Sumedha and Zydus for making me a part of this excellent initiative with regard to recognizing our heroes and heroines and their fight for health, because I think we have more than 200 subtypes of cancer across the world, and of which prostate cancer affects our male colleagues and counterparts and all the male gender across the world. And that's why you have aptly labeled this as Heroes Fight for Health. See, a diagnosis of cancer sends a shiver down the spine of even the strongest of human beings. And then there are so many things which crop up, like how do I deal with the treatment? Will I get cured of this problem or not? Can the disease get controlled very well? And then afterwards, what can be the side effects or impacts of this treatment? And with all these questions delving in, we need to understand that how do you treat cancer? You snare it, you burn it, or you poison it, which means surgical oncology, surgery, radiation oncology, the radiations, and medical oncology like chemotherapy and hormone therapies respectively. And so with these treatments, and sometimes there are complications, you would really be worried. And that's why it's important to take care of not only physical dimensions, but also the mental, the emotional, and the social dimensions also. So we need to treat the cancer patient as a whole, including the family, the relatives, the kith, the kin, and all the concerned family friends. And that's what holistic approach is all about. It goes beyond the domain, beyond the realms of surgical oncology, radiation oncology, medical oncology, and also talks about incorporating exercise, a good, healthy, hygienic diet, including olives, avocados, fish, supplements like calcium, vitamin D, zinc, selenium, incorporating some mind-body practices like yoga, meditation, pranayam, and also trying to look at some other facilitations like acupuncture. So by and large, I believe that we should approach the treatment for these cancer patients with the patient as a whole and not just focus on the oncology treatment per se only. So that's what I think holistic approach is. And every hero who is fighting for this health against this disease, prostate cancer, requires support in all dimensions. That's the true meaning of holistic approach.
Thank you, Dr. Dattatreya, for such a wonderful explanation. Since you mentioned about the holistic care and the overall treatment part, so I would like to know your views about in what ways we can integrate physical, emotional, and psychological support to the patient to enhance the overall well-being while the person is suffering from prostate cancer.
I think all of us should agree with the WHO definition of health. And health is not merely an absence of disease or infirmity. Health basically is a state of complete physical, mental, and social well being. The physical part, the physical dimension, as a treating oncologist, me and my colleagues from the radiation department, the surgical oncology department, and the medical oncology department will take care of it. But on top of that, it's equally important to have some sympathy, some empathy, and compassion in treating our patients with cancer. And again, though of course we as doctors do understand, talk to the family and the patients, it's equally important for the partner, the spouse, the family, friends who are in and around in neighborhood, relatives, kith and kin, and also, most importantly, various support groups, which is what Zydus also partners with. And discussions, deliberations, elaborations with all of them together goes a long way in this crusade to cancel cancer, in this fight to defeat cancer, in this battle to beat cancer. So it's a approach from all of us together, including you, Dr. Sumedha, now, who is trying to make a difference to all of us who are listening to us, inculcating, incorporating the importance of we all coming together to win this crusade to cancel cancer. This applies to prostate cancer. It applies to cancer in general too.
Thank you, Dr. Dattatreya, for wonderful explanation onto that. Moving ahead with the discussion, I would like to know your views on what specific physical therapies or intervention have shown efficacy in complementing standard prostate cancer treatment.
An excellent question by Dr. Sumedha, trying to tell us that what is all which can be done beyond medicine, beyond treatments, beyond what the medical books mention about treating prostate cancer, is to also focus on regular exercises. There are something like Nordic walkings, pilates, recreational activities, physical activity, physical training involving the physiotherapist sometimes in the treatment. So these are all extremely important. And especially being physically active releases various endorphins. And these are extremely important in the mental well being and the emotional uphealing of these patients. So, not only the physical dimension, but the mental, social, and emotional dimension also should be addressed by regular exercises, by indulging in physical activity, by keeping ourselves physically active, and on top of that, also engaging in some specific parameters like Nordic walking, like pilates, and more than that, all of us, including patients who are fighting this disease, should understand that sitting is the new smoking. It's as bad as the way all the harms that smoking can do to the human body. Sitting has been now labeled as the new smoking. So, a sedentary lifestyle is something which should be avoided by one and all across the entire society. That's my message.
Thank you, Dr. Dattatreya, for your insights onto that. Since you mentioned that sitting is the new smoking, but I would like you to please recommend some lifestyle changes, or maybe I would say dietary changes, or like exercises that the one person can include into their lifestyle who is suffering from prostate cancer. What recommendations do you want to give to them?
By and large, cancer is a lifestyle disease. I think all of us will agree that we are what we eat. And so a healthy, hygienic, balanced diet goes a long way, of course, in preventing cancer, but also when you are afflicted with the disease, to aid in my treatments to cure the disease, to control the disease. In addition to that, often forgotten is the importance of nutritional supplementation to parallelly running along with the treatment, because some of these treatments could cause more fatigue, more malaise, some weakness of the muscles or the nerves. And so focusing on a diet which has the right amount of carbohydrates. For example, a healthy, hygienic, balanced diet would mean that approximately 60% is carbohydrates, 20% is proteins, and 20% is approximately from fats. And so that balance should continue throughout. For the height we have, we need to maintain a healthy weight, and so involving a dietitian who will definitely prepare a diet chart. But more than that, some general principles to follow are like what I told you: having optimum carbohydrates, fats, proteins, but also various supplements, vitamins, minerals, especially calcium, vitamin D, vitamin C, zinc, and selenium. All of these go a long way in helping my treatment against the prostate cancer to be optimized. And so incorporating green vegetables, colored fruits like carrots, beetroots, turnips, oranges, these are all these fruits, these colored vegetables, these green vegetables, uh, fish oil, they all contain cancer fighting antioxidants and anti inflammatory mediators. And so it's important to therefore focus on the diet too, parallelly along with the main treatment, which should never be neglected. So, by and large, cancer is a lifestyle disease, and a sedentary lifestyle is something which should be by all of us avoided. Now, for some instance, if the disease is causing some incapacitation, which is not able to make us move freely as others, any others would, in that case, please look into physiotherapy and physical rehabilitation so that the basic metabolic rate or the BMR of the body is enough to burn the calories, and at the same time, with the physical activity and the physical rehabilitation, you're able to make sure that the body's BMR is high, so that the assimilation of the nutrients what we eat happens for the body's good.
Thank you, Dr. Dattatreya, for these recommendations. And I think this is going to be really helpful for the people who are suffering from prostate cancer. One thing which I want to say, that since you mentioned about the dietitians and physiotherapists, so Dr. Dattatreya, in your view, how can you see the multidisciplinary approach when it comes to the prostate cancer treatment? What are your views onto that?
Excellent. So, as you rightly mentioned, we all need to understand that the cause for cancer is multifactorial. You can't pinpoint usually, in majority of these cancers, one reason for the disease or one etiologic agent for the disease or one cause for the cancer. Similarly, the treatment for cancer also therefore has to be multidimensional.
Yeah.
Only the oncologist or the clinician thinking he'll treat and cure the disease would be inappropriate thinking. I therefore need to involve the paramedical staff along with me, my nursing staff, in addition to that, the pharmacist, the dietitian, the physiotherapist, the physical rehabilitation guy, and people who can be psychologists so that they can look at the psychological well-being and try to increase the emotional well-being of these patients. It's all here. So on one hand, our treatments will work, but on the other hand, if there is a positive atmosphere, the right environment around the cancer patient, that goes a long way in making my treatments work in a much more better manner, and that will cause more cures and more controls of such diseases. And this is applicable to prostate cancer for sure, and various studies and researchers have proven that. So, in the battle to beat cancer, our prostate cancer heroes, they also need to be sure that we're all involved in this fight together to emerge victorious.
Thank you, Dr. Dattatreya. Since you mentioned about that all the heroes should come together and they should like each other's support each other. So in your view, I would like to ask, what do you think about the support groups and the peer counseling sessions, how it can help the people who are suffering from prostate cancer, and how these people can relate with each other in this battle?
Extremely important question. And I think the role of all these support groups becomes very, very important and brings up a completely new dimension which was previously not looked at to, which was previously not looked into in this crusade to cancel cancer. So it's so important because these support groups, many of these patients might not open up to me in the OPD or in the counseling sessions, but they might open up to the people who are a part of these support groups, because there you find more and more support groups coming up with more and more patients who talk about their experiences, and then they realize that okay, it's not me alone. Because the first thing that happens when a diagnosis of cancer happens, the first question that person afflicted and diagnosed with cancer asks himself or asks God, why me? Why did this happen to me? Why did I get involved with this disease? Otherwise, my life was going in one direction smoothly, and now suddenly there's a break, and maybe a U turn is happening. So, from that depression, from that anguish, from that agony, the patient needs to come out and then decide to take the cancer treatment. Which is why I believe that all patients of mine who decide to take cancer treatment have now stopped worrying about the diagnosis. They've understood that now I have this disease, this is my stage, and now prostate cancer treatment has to start. And the treatment has been outlined by the team of the oncologists, which could be an incorporation, amalgamation of surgery plus minus radiation plus minus hormone therapy or endocrine therapy plus minus sometimes chemotherapy also. So let me now fight out the disease and stop worrying about the diagnosis. They should have the zeal, the mental strength, the willpower to emerge victorious. And when that happens, half the battle is won already. And that's why I would call all my patients of cancer who take treatment for cancer as not cancer warriors. The cancer now is not worrying them. They are cancer warriors. So, not cancer warriors, but they are cancer warriors because they are now trying to, my prostate cancer patients, and across the world, prostate cancer patients are trying to get some troublesome radiation therapies, some mutilating surgeries here and there, sometimes the chemotherapy adverse events. They have decided to take this head on, and come what way, we will tackle these adverse events, these toxic side effects, and emerge victorious in this battle to beat cancer.
Thank you, Dr. Dattatreya, for these wonderful insights onto that. Since we all know that the person once get diagnosed with the prostate cancer, it actually drastically changed his life. But when it comes to his family also, it actually upside down the whole lifestyle and whole thing of them as well. So what are your views onto that? How can these people can come together? When I talk about the caregivers or I talk about the family, how they can support the patient and how they can deal with their mental health in order to provide the overall well-being to the patient and to them personally as well?
The diagnosis of prostate cancer, the word
Yes.
cancer itself, is
Yes.
will essentially make sure give some jitters to the family, to the relatives and the patient himself. But one good thing about prostate cancer is, unlike other cancers, in prostate cancer, a lot of research has made us come a long way, and many of these patients are now getting cured if it's diagnosed early. And even if it diagnosed late, with all the amalgamations of treatments we have, including endocrine therapies, hormone therapies, chemotherapies, and palliative radiation therapy required, we are able to cure and control many of these patients comfortably for a long time. So, unlike other cancers, in prostate cancer, even stage 4 patients can live for a pretty long time. And that's the good part about this disease. In fact, some prostate cancer patients, the disease can be so benign, the disease can be so docile that in some of these patients, you can just think of observation, wait and watch policy, and decide the right time to intervene if treatment has to be done. So there are some patients, though having prostate cancer, you might still not want to treat those patients because the cancer is having a very slow growth rate and unlikely to cause any harmful impact in the near future or later. And so we can intervene and treat only when required. On the other hand, we have another patient who has a stage 4 prostate cancer and the cancer has gone to the bones or the liver or the lungs. And so we are worried that such extensive disease, does it mean that a death sentence has been given? No, in prostate cancer, it's a disease which is heavily dependent on the male hormone testosterone.
Yeah.
And so we do what is called as androgen deprivation therapy or ADT, where a simple injection or simple oral pills can tell the testicular cells not to produce the male hormone, and immediately the nutrition nourishment for the stage 4 prostate cancer cells stops at the time, and all these cells start involuting and dying, and within a month or 3 months the serum PSA levels become normal, and by 6 to 9 months the PSMA PET CT scan show a very encouraging report. And then this control of disease continues for a pretty long time. So with all the newer advances and newer developments, researches and breakthroughs, prostate cancer is one disease where even a stage 4 diagnosis should not deter you from taking the treatment. So be positive, have the attitude to fight the disease, and you will emerge a winner. And that positivity, that environment, that atmosphere, and the zeal to fight the disease comes from within the patient, and also the family, the kith and kin around him to also support him, telling him it's okay not to be okay, we'll fight it and come out of it.
Thank you, Dr. Dattatreya, for such insights. Moving ahead with the discussion, I would like to ask, like, what are the most common side effects the person can feel while taking the whole prostate cancer treatment, and how he can deal with it?
First of all, let me inform all prostate cancers right now listening to us, all these heroes who are fighting this disease, that all side effects are transient, they are temporary, they are reversible, and they're easily manageable. That was number one. Number two, majority of these side effects are not seen in the majority of patients. So that's again one more welcome note with regard to prostate cancer treatment. Some of these side effects could be only during the treatment for a few weeks. And then afterwards, once the radiation therapy, for instance, gets over, with every passing week and month, these side effects disappear completely. Sometimes we might experience some fatigue, some weakness, some malaise, some asthenia, sometimes some nausea or some difficulty or decrease in appetite. But gradually the body gets adjusted to the medications which the medical oncologist prescribes, and then it becomes smooth sailing afterwards. Rarely do we have a patient where you find that the adverse events are so troublesome that you either reduce the dosage of the medical oncology treatment or give some breaks from the radiation treatments or plan the surgery by deferring it by a few more months if surgery has to be done. For example, one surgery done for prostate cancer patients is called as bilateral subcapsular orchidectomy, where we just remove that portion of the testis which is producing the male hormone testosterone. For
Yeah.
some reason, if the patient is not prepared for getting the surgery done, no emergency. We start some simple tablets, which are now available in India too, or an injection below the skin, LHRH agonist or LHRH antagonist, for which is every month or once in 3 months, even once in 6 months. At the appropriate time, whenever the patient feels comfortable, that surgery can be done or can be abandoned altogether, and these pills or these injections can give equal efficacy. So medical orchidectomy is equal to surgical orchidectomy. So many options, so many alternatives are there, so many substitutes are there, that if one doesn't work, other works equally well. And that's why I think we don't have to worry about the side effects of this treatment, because side effects in prostate cancer don't matter, therefore don't bother.
Thank you, Dr. Dattatreya, for wonderful insights. And I think this is going to help the prostate cancer patient very wonderfully. Moving ahead towards the conclusive part, I would like to ask what recommendation or advice you want to give to the patients out there who are newly diagnosed with the prostate cancer and or are at the verge of this disease.
So now that we are reaching the conclusion of our session in the Heroes Fight for Health, I would like to again emphasize that cancer is a word, it's not a sentence. So don't worry about the diagnosis. Prostate cancer is a word, it's not a sentence, it's not a full stop. And that's why fight the disease. You don't have to worry about this diagnosis. Whatever be the stage 1, 2, 3, or 4, prostate cancer patients have excellent treatments available. And so, number two, who will be treating you? A team of doctors, surgical oncology, medical oncology, radiation oncology, and then decide which would work best for you. One alone or a combinations of all three faculties coming at opportune times to give maximal efficacy against the disease but minimal toxicity to the prostate cancer patient. So that's the goal of each one of the treating oncologists and cancer specialists. Against the cancer, maximal efficacy, but to the patient, minimal toxicity. Three, all side effects are transient, they are temporary, they are reversible, and easily manageable. So don't differ or deter from treatment, thinking that the treatment could cause more harm than good to you. By and large, this is never true. Fourth, cancer is a lifestyle disease. And that's why a holistic approach beyond the treatments is extremely important. So be positive, have the right zeal, have the right atmosphere around you, and then you can do wonders and come out of this struggle and emerge a winner. And so please do not be a cancer warrior, be a cancer warrior, and be an example to the world that we can all cancel cancer. Thank you so much.
Very wonderfully explained, Dr. Dattatreya. So, in conclusion, our objective for today's discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed the topic very comprehensively and effectively by presenting the information in a manner that is both thorough and very accessible to the patient out there. I would like
And
to
so
extend my
I I would just like to again reiterate that health in prostate cancer patients is a state of complete physical, mental, social, and emotional well-being. And so it goes beyond the absence of disease or infirmity. And that's what Sumedha is telling us, that an holistic approach going beyond treatment, incorporating diet, exercise, supplements, if required, physiotherapy, physical rehabilitation, all of this, including positive vibrations in and around the family, and we can win the disease. No doubt about that. Over to you, Sumedha.
Thank you, Dr. Dattatreya, and I would like to extend my gratitude to you for such insightful contribution and sharing the expertise with us. Thank you for joining us today and for contributing this important conversation. Thank you so much.
Thank you so much.